So the problem, what are we trying to solve? There's a huge problem within the insurance billing process. Providers are losing money that's already owed to them. The work has been done, the treatment's rendered, the claim is submitted, but there's no payout. So on average, insurance claim denial rate is at 11%, and that's a lot. So there's about $30,000 to $50,000 in lost revenue each year due to unrecovered aging. And of that 63% of those claims are actually recoverable, which means they can be paid, they should be paid, they just haven't been worked on. And that could be for a number of reasons. Maybe there's not enough staff members or manpower or hours in the day. But in order to get those claims paid, on average, it costs about $118 of admin resources. So now you're paying more money to collect money that's already owed to you. So questions to ask yourself when considering a solution to your insurance billing process. How much time is spent on the insurance process? We know it's a lengthy process with lots of steps. Daily batching, attachments, and submission. Are you attaching the correct x-rays? Are you providing the proper supportive clinical notes? When it comes to submission, you're either submitting electronically or you're making paper claims and submitting it through the postal service. That is all very lengthy. So how much time are you actually spending doing that? How much time is your staff spending doing that? Following up on unpaid claims. So that's a matter of reaching out to insurance rep, logging into insurance website, just to find out a status of a single claim. And that takes a long time. Posting payments. So once you do get that claim paid, your staff member has to post it. So they're reading through insurance correspondences and they're posting line by line, procedure code by procedure code. And there's a lot of room for error. Automation obviously eliminates that error. So there's more room for accurate posting. So when it comes to accounting, it's safer. How much is in your insurance aging? Are you aware of what's in your insurance aging? What's current? What's in your 60 to 90 days? What's over 90 days? And then you need to ask yourself, do you have a process in place for payment reconciliation that will reduce the risk of embezzlement? So there's a lot of questions to ask yourself. And when you're thinking of those answers, Zentist has a solution. So Dr. Zoulas, now that we all understand how Zentist works and what we do, what was it about Zentist that intrigued you?
So one of my team members, my office manager, she approached me and said that she wanted to cut down on some of her time in the office. And Zentist made a lot of sense, so that if my wonderful, amazing office manager decided to completely leave the practice to pursue a different career choice, I was not left scrambling, trying to figure out everything by myself and then retrain a new office manager or a new employee. So this was a really attractive idea. And the other thing that was really huge to me was, as it was explained, how much of it is automated. And I know that there's so much time that is wasted talking to insurances, going to their websites, being, on hold with insurances for hours. And that just seemed like a big time waste. I didn't want to pay somebody in the Bay Area $25 an hour to be on hold for an hour, 2 hours, 4 hours trying to get a hold of somebody with insurance. So that was a huge benefit.
So far, what would you say is the biggest advantage of using Zentist?
The follow-up on claims, I think, is been in the past the big waste of time for our front office, and the fact that they don't have to follow up on claims. For them, that was just a huge weight lifted off of their shoulders. For me, as the practice owner, I think getting my aging down, seeing where the money is, seeing what's being worked on, and having more accountability, because that was something that I delegated and I just didn't know where things were. And I think the third big benefit is seeing small tasks and how much money is related and tied to those tasks so that the team member is motivated to get that done. It might be a really small thing like a change of address or a change in group number or some small thing that they need to investigate. But when you know that that's going to bring in another $1,000 into the practice, you're going to be motivated to do it. Because who is actually motivated to follow up with anything insurance? Insurance is just a big, huge deterrent. And so the less you have to deal with insurance, the better.
Definitely, and that is a perfect segue into our dashboard. So what everyone is looking at is essentially a snapshot of your homepage of your doctor dashboard. Our dashboard integrates with your practice management system. So we'll pull data from your system and apply it to your dashboard. So you're looking at a central location of all of your reportings, how much insurance has been submitted for the week, how much we've collected, and then in big red writing, we have how much money is being held up by tasks. So one of the first things we start working on for newly activated offices is their aging claim, which will generate immediate revenue. We will assess claims up to 1 year old from activation date, and we're looking to see whether or not they can be appealed. And if there's a possibility of that, we'll appeal them twice. We also do cleanup, so we'll automatically close claims where the last correspondence is older than 2 years old, where the benefit is not a covered benefit, if frequency limitations have been met, or if the annual maximum has been met. So we start with cleanup, working your aging claims, and bring in revenue. So our responsibility to the practice, we will submit your claims within 24 hours of receiving the batch. We post within 24 hours your EFTs or EOBs that you scan to us. And we also provide you with chart notes and templates on insurance claim requirements. So this is not required. I apologize for the background noise if there's a lot going on right now. It's not required to use the templates, but we do have them really well written out to where the provider essentially just needs to fill in the blanks. You will provide the supportive clinical narratives, medical necessity, and then you could submit it. You can also pick and pull from the narratives that we provide and include them with yours. So I do want to pass it on to Sarah Miller. She's going to go in depth about our Zentist 100-day plan. She's going to share Dr. Zoulas' results and speak more on it. So Sarah.
Thank you. I appreciate that. Hi, my name's Sarah, and I'm part of the practice success team for Zentist. At Zentist, we created the 100-day plan as a way of addressing particular practices' immediate needs aggressively. Most offices sometimes will do a 30-minute sessions. If they want to go over anything within the first 90 days, we might do those every couple weeks just to touch base and then make a plan as to what we've done and then where we're going. Her assessment results were in 2019. She started in September. Her overall insurance collection during that time from September to December was $122,000. So on average about $40,000. And then of course with 2020 being unique with COVID and everything, and offices being closed for multiple months, it's a little different. At 183,000, and then just on the average of about 24,000. With her insurance aging, I'm really excited about this slide actually, because before her sign up, her aging overall was 70,836, and then after her 100-day plan, it was 15,685, and then after 9 months, it's been under 5,000, and currently is at 4,914. So that's a 93% decrease, with an increase in collections of 65,000. So that's huge. It's not just claims getting closed; they're also getting paid, which is really, really important.
Priority, and that having Zentist has really freed up a lot of my administrator Kira's time to be able to reach out and speak to our patients. A lot of our patients we're finding, because they haven't talked to anybody in months because of COVID. They're a little bit more talkative. And so she needs a little bit more time on the phone with our patients. And I'm just so glad that she is able to spend that time with our patients, making that connection with the patients, because that is the most valuable use of any of our team members' time, is making those touch points, those connections with our patients, bringing the patients back in, getting their treatment done. That's what's most valuable. Having them follow up on claims with insurance, being on hold for hours. Unfortunately, that's the only way we can make sure that we collect the money that's owed to us. But having something like Zentist is great because we can utilize them to make that contact with the insurance so that we can keep our valuable time, our valuable team members focused on what's the most important in our practice, which is our patients.